Is it possible that just the scent or smell of something can actually have a powerful biochemical effect on the body for healing, mood elevation, and actually potentially even help fight cancers? Well, the hypothetical answer to that question is yes. There have been some pilot studies showing that something called aromatherapy actually has a very powerful biochemical effect on the body. This means you're treating disease or ailments or depression or whatever it is without the need of swallowing a capsule or a liquid per se. Pretty fascinating. But let's look exactly into the research and how it began. On a rehash, a study from the MD Anderson Cancer Center back from 2006, when the senior nurse who specialized in aromatherapy basically published this on the MD Anderson Cancer website. I'm going to link that below too. But let's get right into it. All right, MD Anderson teaches the art of aromatherapy to soothe and heal. Now keep in mind too, since this thing in 2006, they have discovered that you have something called olfactory receptors. Things that we used to think were only in the nose, but in the skin, internal organs, basically throughout your entire body. Think of it this way. When you smell, let's say for example, the scent of pizza, whatever it is, you begin to salivate, not just your nose is smelling, the rest of your body is smelling, and therefore encouraging a biochemical reaction, either for a positive means or a negative. And I did 3 videos since this 2006 one at MD Anderson Cancer Center that showed that aromatherapy has a strong credence in medical literature. The first one I did was citrus scent inhibits liver cancer, and I'll link those down below too. The second one is wound healing was basically accelerated through the scent of sandalwood. And third was obviously lavender can have a psychological effect as far as increasing your trust in people. But let's get right down into it. So the MD Anderson Cancer Center did this back in 2006. And they want to explain to you first what an essential oil is. Generally, if you look at the Wikipedia, an essential oil, let's go by their words and just quote it, is a concentrated hydrophobic liquid, not meaning afraid of water, per se, kind of like that, but not exactly like a paranoia, containing volatile aroma compounds from plants. It takes a lot of plant material to make a little bit of oil. You're basically juicing the plant. Whether you're juicing rose or sandalwood or whatever it is, you're steam distilling a large portion of this and you're getting those volatile organic oils out and making it into small little whatever it is, a vial, something you smell. It often gives the plant its smell. So let's proceed forward. And back in 2006, MD Anderson Cancer Center was finding that he had discovered some anecdotal evidence through observation, not through clinical trial per se, that they had a few oils that had a strong positive effect in regards to people undergoing cancer, or I should say chemotherapy, radiation, whatever it is. Now keep in mind, before I proceed, you've got to communicate with your oncologist. MD Anderson Cancer Center was also very, very adamant that basically certain oils can have a negative effect in regards to certain medications. So, but let us proceed forward. Lavender. This is from Sherry Perez, just in case I did not mention in the beginning. She was a senior nurse, and this is her recommendations. Lavender, first used as a perfume by ancient Egyptians 2,500 years ago. Lavender is now used to treat insomnia, migraines, and provide stress relief. Number 2 in the recommendation column, rosemary. The fragrant plant relieves muscle pain, low blood pressure, and cold feet and hands. Cold feet. Yeah, sorry about that. Spearmint. The oil from spearmint aids digestion and eases nausea and vomiting, and of course in the masculine sense, such as bay laurel, ling lang, whatever you want to call it, appeal to men for their deep scent, they say. They also treat skin rashes, rheumatism, and stomach ailments. Now, just to back up and give a little more credence to what the Cancer Center came up with back in 2006, there was another study, for example, I want to mention that had to do a post-operative nausea, published in the Journal of Anesthesia and Analgesia 2013 in September. Now, what they did is they did a double-blind crossover placebo, basically randomized trial. And I bring this up because it gives validation outside of just the observation from the MD Anderson Cancer Center. Let's look at what they discovered. They took 301 patients and basically they were experiencing nausea from post-operative, well, basically after an operation. They felt nausea. So what did they do to relieve it that worked? Let's go into the study. They said 301 patients reported nausea after surgery, randomly assigned to receive one of 4 types of aromatherapy. We're just going to cover the first 2. 2 groups received true aromatherapy, which with essential oil of ginger or a blend of aromatherapy oils. The blend they used, just to rehash, was ginger, spearmint, peppermint, and cardamom. Basically placed in a gauze pad and they just smelled it. Guess how effective that was? That blend was 80% effective in reducing nausea. Now ginger alone basically was powerful too, but that was 70% effective. The blend was 80%. So you see, there could be a little bit more refinement as time goes on to find out which blend works best in a medical setting. Now I can proceed forward to the rest of the study. There's some notes of concern that Sherry Perez brought out. But remember, if essential oils have a medical impact one way, they can have a negative impact the other way. So you need proper training or medical professionals which are aware of the biochemical effects of these incredibly beneficial oils. Let's see what Sherry Perez said back in 2006. People with high blood pressure should avoid hyssop, rosemary, sage, and thyme. It says while diabetics should avoid angelica oil. Women who are pregnant and nursing should avoid a number of oils that stimulate the uterus, including star anise, basil, and juniper, to name a few, and should use with caution peppermint, rose, rosemary in the first trimester. According to Perez, pediatric patients can use aromatherapy essential oils in very low concentrations. So you see, they're beginning to first through observation, then to hypothesis, then theory, of course with further testing, that yes, a scent can have a powerful biochemical impact on the body, even maybe more so than swallowing a capsule or a liquid, which is kind of cool because think about it, to actually be treated for a medical condition just by walking into a room with a healing aroma. Now keep in mind on move forward, Sherry Perez also came up with certain issues in regards to purchasing essential oils that I want to cover real fast, and this again is going to be found in the MD Anderson Cancer Center website. So let's look at it. Her points are: essential oils from a bath or general store may be of questionable quality. Shop for oils in a specialty store staffed by salespeople with aromatherapy training. As part of the point, you have to watch out for some of the side effects of essential oils aromatherapy with certain individuals. So you gotta need a little bit of finesse and training. Just don't go blindly into it. Well, it smells good, I'll use this. 2, quality oils which are light and heat sensitive. Light sensitive, heat sensitive. Are going to be in a brown or blue light protective glass. Other reason too is glass doesn't react chemically often with a lot of different things, where plastics tend to be very, very chemically reactive with a large number of things. You don't want to contaminate the oil. 3, labeling on the bottle should provide both the common and botanical name for the oil. Just an act of professionalism. Since there's many varieties of certain plants, you can have different varieties of cinnamon, so on and so forth. Make sure it's the one variety or botanical name that you're looking for so you can reproduce those results over and over again. Just don't get cinnamon as an essential oil, since there could be different species of cinnamon per se. Number 4, steer clear of concentrated oils with rubber eyedroppers. Here goes the chemicals mixing. Since the oils react with the rubber, causing it to break down and contaminate the oil. Bad news, rubber droppers break down, chemicals from rubber enter whatever it is, you change the chemical components of the oil altogether. So, to reiterate, essential oils are being shown, or I should say, are very promising in the world of medical literature. Just needs a little bit more confirmation, a little bit more finesse on how to use them and how not to use them, so to say. And again, it is possible to treat ailments or disease, hypothetically, with just the aroma of a powerful botanical oil. Doesn't mean I should say powerful, just a botanical oil. Again, this is Ralph Turchiano signing off. All the links, what I mentioned, will be down below. And I really, really, truly do hope this helps. Thank you very much once again.